Hi, my name is Emily Harrell, and I'm a second-year medical student at Idaho College of Osteopathic Medicine. I'm working under Dr. Adam Schatz at the Idaho Urologic Institute, and today we'll be talking about interstitial cystitis. If you're watching this video, it's likely that your doctor has either diagnosed you with interstitial cystitis or they are currently in the process of doing so. You might see this referred to as IC. To help you gain a better understanding of your symptoms, let's review the anatomy of the urinary system. The urinary system is made of the kidneys, ureters, bladder, and urethra. The kidneys filter waste products and excess substances, like sugar, salt, and water, from your blood to form urine. The urine is sent down the ureters into the bladder, which is a triangle-shaped hollow organ in the lower abdomen. The outer layers of the bladder are made of muscle and contract during urination to empty the bladder. The inner layers, called the mucosa, serve a protective function. Imagine the mucosa layer of the bladder as a waterproof seal on a water bottle. Just as this seal prevents leaks and keeps the contents safe, the mucosa layer of the bladder forms a barrier that prevents urine and waste products from seeping into the underlying tissue. It's like having a protective shield that maintains the bladder's integrity and ensures its proper functioning. The definitive cause of interstitial cystitis is largely unknown. Some research speculates that it could be a primary condition or caused by something else, like irritable bowel syndrome or fibromyalgia. Some factors are known to make symptoms worse, such as acidic foods or substances found in cigarettes can irritate the bladder wall. Other factors that can contribute to a higher risk of developing interstitial cystitis include being assigned female at birth, being older than 30, and having a previous chronic pain disorder such as irritable bowel syndrome or fibromyalgia. Most people with interstitial cystitis experience urgency to urinate, frequent urination, pelvic pain, or pain with sexual intercourse, but some of the symptoms will vary depending on the person. Women may experience pain in the pelvis or between the vagina and anus, and men may experience pain between the scrotum and anus. A key characteristic of pain that is related to interstitial cystitis is called painful urgency, which is when the urge to urinate is because of pain, pressure, or discomfort. Then, this discomfort is relieved with urinating. If you've ever had a urinary tract infection, the symptoms of interstitial cystitis might sound very similar. However, IC is different because the symptoms last for longer than 6 weeks, and no bacteria are found in the urine culture, so there is no direct identifiable cause for the pain. Because of this, many patients with interstitial cystitis fail antibiotic therapy. Additionally, symptoms of interstitial cystitis can occur in flares, where symptoms intensify for several hours, days, or weeks. Some people find that alcohol, spicy foods, caffeine, and smoking cigarettes can cause a flare or worsen their symptoms. To help your doctor make an accurate diagnosis, be sure to record what you eat and drink, number of times you urinate per day, and all of your urinary symptoms. This will help you and your doctor determine if there are any foods that may be causing your symptoms. It is important to understand that you and your doctor make a team. You should always feel comfortable asking your doctor questions, as it is important to understand what is going on with your body. Interstitial cystitis is called a diagnosis of exclusion. This is when medical professionals rule out the diseases that have poorer outcomes or are more acutely serious. To do this, they will do tests like urinalysis, urine culture, cystoscopy, and urodynamics. Urinalysis and urine culture are typically done multiple times to ensure that there is no infection or blood in the urine. The reason for this is that IC can easily be misdiagnosed as a urinary tract infection. Along with these test results, there are a few differences between these two diagnoses that can help physicians distinguish between the two. IC typically presents with flare-ups that can occur for up to 6 weeks, whereas urinary tract infections usually subside after a week with proper treatment. IC patients also experience a painful urgency to urinate and have pain relief with urination, whereas urinary tract infections often cause pain or discomfort with urination. If it has been confirmed that there is no infection present, the physician can continue doing more studies to confirm the diagnosis. Most of these studies are to confirm that your symptoms are not caused by something else. A cystoscopy is when a small camera is inserted up the urethra to visualize the bladder. Your doctor may consider doing a cystoscopy if there is blood in the urine, whether you see it or your doctor sees it under the microscope. In this case, they will want to rule out bladder cancer by looking into the bladder and taking a biopsy of the inner lining of the bladder if needed. The most important finding in the diagnosis of IC is the presence of Hunter lesions, which are like stomach ulcers, but they're found in the bladder. These are important findings because they change the treatment of interstitial cystitis. Your doctor also might order something called urodynamic studies that show how well the bladder is functioning. This is used when the doctor is trying to rule out other reasons for urinary symptoms. There is not a specific treatment that cures interstitial cystitis, and a treatment regimen that works for someone else may not work for you. There are many different treatment options and combinations that you can utilize to help reduce your symptoms and improve your quality of life, but this takes patience and a lot of trial and error. These treatment options include oral medications, medications that are put directly into the bladder, and pelvic floor physical therapy. Bladder distension, bladder injections, and neurostimulation are options if first treatments fail. Surgery to remove the bladder is a very last resort and very rarely performed. First, we'll start with oral medications. Most medications used in the treatment of interstitial cystitis are indicated for other illnesses, but have been shown to be effective in reducing IC symptoms. Some of these are found over the counter, and you do not need a prescription for them. Examples of these include Providium, Azo, anti-inflammatory medications like ibuprofen and naproxen, and antihistamines like Claritin. All of these medications work by either numbing the bladder or decreasing inflammation, which should help alleviate some of the pain. Some medications will need a prescription, like amitriptyline, Urabel, or hydroxyzine. If your doctor has done a cystoscopy and found Hunter lesions, or those ulcers in your bladder, your treatment will include fulguration, which is when your doctor will use electricity or a laser to destroy the Hunter lesions, and possibly injection of a medicine called triamcinolone directly into the bladder. Both of these procedures typically require some type of local or general anesthesia and may have to be repeated. If you do not have Hunter lesions, they can put different medications into the bladder directly, or perform a hydrodistension, which is when the bladder is filled with low-pressure water for a short period of time. The reason why this works in some patients is unknown, but it's possible that the slight stretching of the bladder can block the pain signals. The next discussed in research is neurostimulation, which is the implantation of a device that sends tiny electrical pulses to help regulate the pain signals coming from the bladder. This treatment helps urinary frequency and urgency that may be caused by a different diagnosis and may not improve your pain. It is not currently FDA approved for IC treatment. Surgery, such as urinary diversion with or without removal of the bladder, is typically the last resort when patients have exhausted all other treatment options. The selection process for surgery is very restrictive, and patients have to meet certain criteria to be approved by their doctor. Surgery is very rarely performed for IC. As we said before, the treatment of IC utilizes many different methods, and some behavioral modifications can help alleviate your symptoms without taking a pill or having a procedure done. For example, avoiding food that triggers symptoms, stress management, and decreasing constipation can all help alleviate some of the symptoms associated with IC. If trained clinicians are available, manual pelvic floor physical therapy techniques like maneuvers that help mitigate trigger points and release scar tissue can be extremely helpful in alleviating symptoms. Pelvic floor strengthening exercises like Kegels should be avoided as they have not been shown to be effective and may actually worsen the symptoms of IC. However, know that every patient is unique. Your doctor and physical therapist will work with you to find a treatment that works best for you. This is not an all-inclusive list of treatments, and there are many more options and possibilities. It is important to realize that all of these treatment options have risks and benefits, and your doctor will help you navigate through these choices to determine the best fit for you. In summary, the cause of interstitial cystitis is relatively unknown. There are many treatments that can help improve your quality of life. Thank you so much for joining me today, and I hope this helps you navigate a complex issue. Remember that you and your doctor are a team, and you will work together to find the best fit for you.